everybody. It's Dr. Laura with Connect My Brain. We are so excited to have you join us today. I always love having guests come on to the podcast because, it's great to share information all around the world and to bring that information into our audience. So today, really excited, we have Sean Brock from Neuro Colorado. That's right. He is out in Colorado and he does neurofeedback. And we're going to have a conversation about thinking about neurofeedback to help individuals and how can it help and who is it ideal for. So Sean, thank you so much for being on the podcast today.
I'm so happy to be here, Dr. Laura. I've really been looking forward to this week.
Well, great. And we're so happy to have you. So go ahead, tell us a little bit about yourself and tell us about your practice.
All right. Well, I am a licensed professional counselor, and so I've been a counselor, a therapist for 14 years, and have worked at this company the whole time,
Wow.
all of my jobs. So I have been interested in sort of the most effective, most efficient ways to help people feel better, whether that's specific types of psychotherapy, EMDR, internal family systems, some specific techniques like that, as well as neurofeedback and neurostimulation techniques to try and address the brain itself. We're a sort of small practice here in Denver. There's 5 of us that work together, and we have been treating a wide range of ages of folks. We kind of start at about 7 years old and go through end of life, and treating everything from complex PTSD to kids with ADHD. So a really wide range of things. All of us are counselors here, and so we use neurofeedback and neurostimulation for mental health purposes in particular, even though neurofeedback and neurostimulation can be utilized for more than that. That's what we're licensed to do. So at our practice, that's what we focus on.
Well, I just love that, within our own little professions, we can add different tools so that, it offers a wider wider net for the patient, and they're able to see what is like that best fit. And I know for myself, I'm a chiropractor, and my practice started off as most chiropractors start. And then I just had this abundance of kids come in. And then there was kids that had challenges, and it just really expanded my mind to go and look and learn all these different things. And the way I got into neurofeedback was back in 2008. I love the primitive reflexes, but it was very difficult to try to explain to a parent what a moro reflex response would look like. I got it, but when I said, "Oh, did you see your kid startle?" they would like look at me going, I'm not really sure what you're talking about. And the first system I got was from Thought Technology, but one of my colleagues, Dr. Barwell, he created this stress response test. And Moro activates 3 things: arousal, CO2, O2, and the sympathetic nervous system. So I'm going, well, this is ideal to quantify, is somebody in a chronic stress pattern? And so that was a very first system that I got started on, and there was neurofeedback options. So then I start dabbling in neurofeedback, and I'm like, wow, this is really cool. You can make incredible changes, and it just seemed to happen faster when you were combining efforts. I like to think of it as neurological stacking, but when you were adding not only what you do with movement and primitive reflexes, but now you're incorporating the brain and getting that feedback to the individual. I was like, wow, this is incredible. And then it just set me on a path to go get board certified, get a diplomate in it, and I just love it. But what attracted you to incorporate this into the idea of counseling?
Yeah, I'm glad you asked. I was going to say, I feel very similar to you in that it's like there has to be more, right? Like, well, like what else is there? How can we address not just someone's experience and how they're feeling, but the nervous system itself directly? And so, from my perspective, I was going through before I was in grad school. I was a backpacking guide. Would take groups of teenagers out. We did a lot of wilderness-based therapy where I was the
Mm,
guide and I'd be out there with therapists. So I was observing and participating in some very intense group therapy. Worked at a residential treatment facility as well, and again was able to participate in pretty intense longer-term therapy. Went back to grad school for a counseling degree, and while I was in grad school, had the feeling of, is this all there is?
mm,
Is this the whole field of counseling? And not that it's not wonderful and effective, but I'm like, it has to be able to be more effective than this. And we're missing the brain. We're just talking about the person, but assuming that the person doesn't exist within a body. Um,
right.
and so, fortunately, one of my professors also owned a neurofeedback practice and taught a 1 day seminar, and things started to click for me. I was like,
Mm,
oh, this is the other half. What I feel like is a real focus on the brain and how to directly influence the brain. I was able to get an internship with the co-teacher of that class, who also owned a neurofeedback practice, um, and then was able to get a job with her after the internship. And a couple years later, she retired, and I purchased her practice, and that
ah,
was 12 years ago. And so here I am today. But so from the very beginning, even in school, was we have to be able to look at um, I like to use the word software and hardware, right? So
mhm.
we have to be able to look at the software, someone's experience of themselves, their thought patterns, you know, how their past is influencing them in the present, all of those things. But we also have to look at the brain itself, the hardware, and say the way I believe and the way I think and the way I behave tells my brain how to structure itself, but also the
Yes.
way my brain is structured in my genetics and developmental processes impact how I feel, how I experience myself, how I think. And so for me, it's how do we try to impact and understand both sides of this thing that creates me, that creates a
Oh, yeah.
person, or what a person would think of as themselves. And so, yeah, I feel like neurofeedback and neurostimulation and the assessments that we're able to do and understand why somebody might be feeling how they are from an electrical perspective in the brain
Mhm.
gives us such a better insight into who they are, why they feel how they feel, and then our options for treatment planning really open up to help them to get from where they are to kind of how they want to feel.
I love it. We do totally resonate on this idea that, we've all got the same stuff up there, but our experience has really impacted how the circuits got wired. And like when I do a brain map, I don't ever want to take the map and go, okay, this is why you are the way you are, but rather look at the map, what the person is going through. And because the majority of my practice is kids, look at that developmental journey and how did it all influence to where your brain is right now. I actually had an amazing case this morning that, I don't know what I was expecting when I was going to meet the young man, but he was going through like impulsive tendencies and lack of motivation and some procrastination. And in my world, most of the time what I do see is developmental delay. And this young man was not developmentally delayed. He was quite sharp. But as the story unfolded, and this is what I always refer to as the blueprint, as our time together unfolded, what I actually realized was that I think there was an injury at birth. The shape of his head alone was very elongated. And I'm looking at this compared to his parents. And then I find out the cord was wrapped around the neck as well as they used vacuum extraction. So everybody knows the baby soft spot. You put, the cranial bones are so pliable at that time. You put a vacuum on it, you literally cause a stress to the structure. And if it's not removed, bone grows in the direction of stress. And therefore, that's the position. And you could even see how his posture of his body looked more externally rotated, and the cranial plates go through flexion and extension, and it's like his whole body was stuck in extension. And if these things are not changed, there's an impact on that developmental journey. And ultimately, like you were saying, how those brain waves and the architect gets shaped, it's going to play a part on a certain aspect of the brain and lead to the symptoms of impulsivity and procrastination and motivation. Because this young man was involved in sports, he is, he's well together, but there is something holding him back. And I'm excited to see what we can do together in order, not only from neurofeedback, but even from a chiropractic model. I'm going to be able to work on that cranium and make a change. So, how do you match one of your cases when people come in and I would assume, and correct me if I'm wrong, but I would assume that most people think when they're going to go see a counselor, they're just going to talk. So, how do you connect that dot for your patients?
Um, it depends on why they're here. So many people do come in specifically for neurofeedback,
Oh, great.
especially kids. Um, so before I get into that, I want to just riff a little bit on what you were saying, because I love that you're looking at um, injury to people, that you're looking at what may have happened in birth or physiologically or retained reflexes or different things that are going to change neural development
Mhm.
in folks and impact the way the brain orients itself, and how neural networks are created. I also look at injury, or things that define how the brain is going to orient itself or
Mhm.
what neural networks are going to be created. But I look at it more from the relational side.
Mhm.
What are the injuries that occurred relationally? What are the things that happened in someone's life that are going to impact the way they experience themselves and the world around them? Um, I think the ACEs study is an amazing example of how adverse childhood experiences create this lifelong
Mm.
impact,
Yeah.
even on physical health.
Yeah.
And so, if your listeners don't know about the ACEs study, just Google it. It's amazing to see challenging childhood experiences and the correlation with really dramatic adulthood disease processes
Yeah.
that happen. But I look at it more from the mental health and the counseling side, and what may be happening for folks. And as far as connecting counseling clients with this idea of neurofeedback, um, I think part of it is explaining to them. Some folks come in and it's clearly a counseling case.
Mhm.
Uh, they were fine. Everything was great. They got into a car accident. Now, every time they get in a car, they feel panicky. They feel scared and overwhelmed. We can do some EMDR, some counseling techniques to help them uh, desensitize their fear around cars, or to process through that specific trauma to find that freedom again. But most of our cases are much more complicated than that. People's lives and stories are way more complicated than that. And so if we can help, if somebody comes in and says, hey, I've felt anxious for decades, and I don't really know why. I had a great childhood. Like, I don't know. I just feel this way. You know, I'm going to say, hey, let's look at your brain's electrical activity. Let's see why, from an electrical perspective, you may be feeling a lot of anxiety. We can dig in on the counseling side and try to figure it out, try to understand where it came from and why, and we may have some great results from that. But if we can also look at your brain and say, oh my gosh, your anterior cingulate gyrus is like way overactivated and so much is going on. Of course you have difficulty transitioning from one thing to another, or you feel stuck, or you're ruminating, or whatever the thing is. It's like, we can directly teach you how to decrease the amount of fast wave activity in that area, and your anxiety will go down. So it's pretty amazing to be able to show people what is happening in their brain. And then for most of the people we work with, they come in feeling bad about themselves because they feel bad. And when you can show them on an EEG that, this isn't made up, this is real. There's objective data that says, yeah, you should be anxious, or you should have a very difficult time paying attention, or, oh my gosh, it's impressive that you got out of bed today. Your brain looks very depressed. Like, wow, well done. It's so validating to their experience. And then to say, hey, we have options that may include talking about it, processing your past, doing all the counseling stuff, but it may also include you learning to self-regulate and changing the way your brain is functioning through neurofeedback and neurostimulation.
I love it. You do a technique, that EMDR. I've always been incredibly fascinated by it. I would love for you to share with the audience what it is, what the goal of it is, what your thoughts are about it, and have you done neurofeedback training during a session of EMDR? And if you did, what did you see?
A lot of pieces to that. I will say, so EMDR, in a nutshell, a lot of people ask, hey, how's EMDR and neurofeedback different from one another? And I think EMDR is presented as a neuro-based or a brain science-based counseling technique. So in people's minds, there's some overlap. The reality is that they're not really connected at all. But EMDR is it stands for eye movement reprocessing and desensitization. It is a counseling technique whose goal is to reprocess past trauma so that the past no longer influences the person in the present moment. So when we talk about a trauma, all of us have negative past experiences. Not all of them qualify as a trauma. And so if I think back on something that was really hard in the past and I say, man, that was hard, that's not traumatic, right? It may have been in the moment, but it's not a current trauma. If I think back to a past experience and I get in touch with it and boom, there's a huge wave of emotion. Or my thinking changes, or my affect changes. I can't sleep. I can't stop thinking about it. I start crying, or having a panic attack. That is the definition of a trauma. When the past is still alive in the present. Okay, so we're experiencing it right now again. It doesn't have to be a full flashback, but it's still, we're really feeling it now. So the goal of EMDR is to process through those traumatic events that still have a lot of energy today and help the brain categorize it as a past event. It's closed.
Okay.
It's over.
Okay.
And when I think of it, when I touch it and remember it, there's very little to no energy left. It's been consolidated and stored in the past. Traumatic events, our nervous system still believes they're alive and active, right?
Yeah.
So they're still
Okay.
trying to manage them. So the process of EMDR, we don't have to get too much in the weeds, but essentially is to have one foot in the past, partially re-experiencing the past event,
Yeah.
one foot in the present, understanding that it's different now and I'm not there.
Mm-hmm.
And then I say we light up that neural network. When we start to feel it,
Mm-hmm.
that neural network gets lit up, and we just follow. Um, we follow what our nervous system brings to us,
Wow.
and so we tend to store memories in four main ways: visually, through images, through thoughts, cognitions, body sensations, and emotions. Those are the four main ways.
Okay.
And so we're with EMDR, we're following. We might feel very angry, and then we may have a thought, I shouldn't feel that way. And then our bodies, we may feel sick to our stomachs, right?
Mm-hmm.
And then we may have another picture or image, and we're just following this until it goes to a 0 out of 10 on how
Wow.
upsetting is it. And then we repeat the process until it stays at a 0. There is an element of bilateral stimulation that happens
Mm-hmm.
with EMDR. And so originally, and still in large part, it's an eye movement based technique. And so while you're processing, while you're remembering the past event, your eyes are moving back and forth,
Mm-hmm.
left and right. Um, some folks use audio, and so there will be a beep in one ear and then a beep in another ear, or you can use hand buzzers.
Mm.
It'll vibrate in one hand, vibrate in the other hand. And nobody 100% knows why this is really helpful, but many of us think that it is a bilateral stimulation of the brain
Yeah.
that's occurring. So left hemisphere, right hemisphere helps in the integration or the reintegration of this information. With neurofeedback, when you're measuring EEG, Dr. Laura, you know
Yeah.
this, your listeners might not. When your eyes move back and forth, it destroys all of the data.
That's right.
Right? The optic nerve is a very powerful nerve in the head. And so when your eyes move, the optic nerve moves, and it creates this big electricity like wash back and forth, back and forth, back and forth. And it messes the data up. So we can't do that type of EMDR while we're doing neurofeedback. I guess you could do the hand buzzers or audio.
Oh, okay.
It would be
Yeah.
hard. It would be hard to attend to the
Uh-huh.
neurofeedback and attend to your own trauma processing at the same time, but somebody could. One of the things that we do here sometimes is we actually use slow wave electrical current stimulation of the brain. So it's an alternating current stimulation at a very low intensity and slow frequency to mimic the eye movement electrical wave that goes across the brain. And so there's a guy, Dr. Nicholas Dogris, who was the first I heard present the idea that maybe that electrical field that's waving back and forth over the brain is part of what helps EMDR be effective. And he said, hey, let's use a stronger electrical field and actually use electricity. And so we're using this slow wave electrical alternating current instead of the eye movement for EMDR, and it has been quite effective for us. So
Wow.
that's one of the ways that we've integrated neurostimulation in the counseling technique of EMDR. And it's been really cool, really powerful.
Sean, that sounds phenomenal. I really hope the audience can grasp this, especially if you're living out in that Colorado area. What part of Colorado are you in?
We're in Denver, so kind
Denver.
of the
Okay.
heart of Denver itself. Yep.
So really grasp what he's talking about, that we can, the traumas that people go through and the ones that are just kind of they're staying around and they're generating that same kind of emotion. We can incorporate the brain and settle it down. and he's using not only EMDR techniques, but they're also using neurofeedback and doing it. Is it slow cortical potential? Is that what you're doing?
No, it's actually it's not neurofeedback, it's neurostimulation.
No,
So
okay, and
we're
how are you
using,
doing that?
yeah, so we have, part of our practice is neurostimulation, and so we introduce different types of electricity to the brain. Predominantly, we're using small amounts of alternating current electricity, and
Okay.
we can choose the frequency
Yeah.
that we provide. So anywhere from like zero point 0.3 hertz, so like a third. Well, it takes 3 seconds for one wave, and we'll go up functionally, maybe to 40 hertz. We can go into gamma, but um, and what happens when you introduce alternating current electricity to the brain, and again, it can sound scary, like electroshock
Yeah,
therapy or
that's
something
what
like that.
people
It's
think.
it's
So definitely
yeah,
clarify what
it's
that
yes. I
means.
will clarify. Um, what happens with neurostimulation is we're introducing electricity to the brain, but the brain is an electrochemical organ. So when neurons fire, it creates electricity. When we look at EEG activity, we are measuring the brain's production of electricity. So when we introduce electricity, we're recruiting the neurons to fire at the rate to synchronize with the frequency that we're providing.
Oh, that's great.
And so if we're introducing 13 to 15 hertz, then the areas of the brain where the neural stimulation is going through will then begin to fire at 13 to 15 times a second, and then they get good at it. And
Mm.
so it's an entrainment device to help the brain practice something that it kind of stinks at doing on its own until it gets good at it. Electroshock therapy, and I am not an expert in ECT, I'm not a physician, but it uses electricity, but in a very different way. The intensity is thousands of times more intense. And the goal is actually to deprogram the brain,
Hmm.
to break down neural networks and neural patterns in hopes that somebody with treatment resistant depression or someone in a catatonic state where all other options have failed, if we just sort of break up this stuck pattern that they're in and kind of try to hit the reset button on the brain, then hopefully when it kind of gets going again, it will reformulate in a way that's better than a catatonic state. And so um, we are using electricity to help the brain synchronize with something and build something, and ECT is trying to break or destroy or disintegrate patterns that are really negative
Well,
for
and
somebody.
I think
So
the key
super
word there
different
is
applications.
resistant to anything else. So,
Yes. Yep.
well, tell us about where is your practice? How can folks find you? What is your website? What is the ideal patient that really does well with your expertise?
I would say, well, you can find us on the internet. We're at neurocolorado.com. You can, of course, call us 720
Okay, say that
Um,
again, nice and
yeah,
slow.
720-232-0834.
Good.
Um, and we have a wide range of folks that we work with. Different practitioners here specialize in a few different things, but I would say overall as a practice, folks with trauma, PTSD, complex PTSD, the challenging cases for folks are something that we really specialize in, and
Mm.
folks we really love helping. Um, you know, Anxiety and OCD and ADHD are all really common
Mhm.
folks that we work with as well. So basically, folks that feel like, hey, my life, like I don't feel the way that I want to feel,
Yeah.
um, or or I feel like my past really haunts me today.
Hmm.
Um, those are the folks that we would love to work with and help you go from kind of feeling stuck or hopeless or like life just, I don't know, life isn't great, um, we would love to help those folks go from where they are to feeling much, much better.
I think one of the things that really intrigued me about having our conversation was, even though we're both in two different professional arenas, look how we can come together and have a conversation. This is the thing that I feel like our healthcare system is really missing, is collaboration. And I always like to say it's like you put the patient in the middle of it, and who can best serve. And it can certainly be more than one. And having that collaboration, don't you feel that the patient in the middle is going to be so better served when we as professionals are able to talk about things and see the benefit of each other?
Absolutely. And I think so many not mental health professionals, so many medical professionals, we're quite siloed
Mm-hmm.
into our approach to seeing things.
Mm-hmm.
And we are, from a counselor side, we are not thoughts and feelings. Like, we are part of a body, and our body and all of the complexities of the body influence how we feel.
Mm-hmm.
Um, somebody may come in and feel depressed, and their thyroid may be not producing enough thyroid hormone, and they feel really sluggish and slow and depressed, right? Like, there's all sorts of ways where there's such important overlap.
Yeah.
But because we're not communicating well, there's not an easy way for integration to happen. Um, I feel like it's really important to be talking, and we're missing out on amazing other perspectives that can
Yes.
transform client care.
Yes, absolutely. I mean, and there's so much neat stuff out there, and things are being created all the time. And what might work really well for one may not work well for another, but if they went a different way, it would. And, one of the very first things that I learned in neurofeedback was we got to break that arousal pattern. Are you under aroused? Are you over aroused? So that we can begin to
Yep.
get some cognitive flexibility, so that we can begin to get the brain to even think for a minute that change is possible. So
Yep.
I'm so excited to share that kind of information with you. Do you see the same thing?
I definitely see the same thing. Yeah, I when we look at um, I'll say quantitative EEG. So,
Mhm.
and for folks listening, that is when we take an EEG of someone's brain, and then we compare it to a statistical average. So we say, hey, we're looking at this 10-year-old boy's brain. How does his brain's electricity, like the amount of electricity he has in different frequencies, how does that compare to other 10-year-old boys? So when we look at that data, um, we can get we get so much information about what is happening for
Mhm.
them. And I think most of the time, but not all of the time, I think of a teeter totter.
Yeah.
Is it tipped towards the fast frequencies and this high sympathetic tone, this fight or flight kind of high activation tone, and we need to work on calming the persons down? Or are we tipped towards this slow wave activity where we're looking at more either depression, but more often attentional issues or dissociative issues,
Mhm.
and we need to decrease the slow and increase the fast, and sort of bring this balance back to this teeter
Mhm.
totter
Yeah.
on either side. Some folks have both going on. It's a little more complicated of a case, but yeah, we looking at that. Why are we stuck in one side or the other side, and how to create that movement initially for that person is so important, and to
Yeah.
bring the other system um, back online or give it way more energy so that it can balance out.
I just love it. So we're gonna wrap up our time together, but if they're like you know your clientele. What is something, if you had the opportunity just to kind of get out on a microphone and tell everybody in your area, why should they come to you? What do you have for many different people from the standpoint of encouragement to take that step and see what you can do differently?
The thing I want to leave people with, or if I could tell people, is of course we would love to see you. But the message I really want to send is I want people to prioritize um, their health and their mental health, and to have hope that they can feel better and they're not as stuck as they think they are.
Mm.
The hill to climb is not as hard as you think it is. It's not easy either. It's not a snap of the fingers, but uh, there is hope out there, and there is or there are lots of approaches to feeling better. Um, our goal is to take all of the soft skills, all of the traditional counseling skills, um, and the most efficient approaches to that as we can, but also to couple that with an understanding of the brain and some technology and expertise in how to directly influence the brain, put those things together, and to try and get a really top down, bottom up approach to helping somebody feel better.
Oh, I just love it. I do. I feel like we are energetically resonating, and
Mm.
I really want to just highlight that one more time, that two totally different professions and really focused on bringing the well-being and the balance to individuals, but we share neurofeedback, and then we each have our own little complements that we add as well. Well, I'm going to encourage anybody in your area. I especially loved how you explained EMDR and how you explained the trauma versus just a bad experience. And I'm sure that that has resonated with our audience. And I know there's somebody out there that's going, oh my gosh, that's me. Well, if that's you, then I'm going to encourage you. If you are in that Colorado, Denver area, reach out to Sean and Neuro Colorado facility and have a conversation, because you can feel better. It may be a little bit of muscle work to get it done, but you can accomplish it. So, one more time, tell people how they can get in touch with you.
Best ways to go to our website. It's neuro, Neuro, Colorado.com. If you like phones better, feel free to call us. It's 720-232-0834. You can reach us that way. Yeah, we would love to see anybody. We do free consultations with anyone who's interested in learning more about our approach to mental health treatment. And if it's a good fit, we would love to work with you. And if not, we'll help direct you to somebody that would be a good fit for you.
That's great. And if you heard Sean on the podcast and it's going to get you to call, I want you to let him know. Say, hey, I heard you on Connect My Brain's podcast. And that way, Sean will know that he has a way of reaching his community. And we always say the community is the world. So thanks everybody for tuning in. ConnectMyBrain.com is our website. You're welcome to go take a look. And if you want any of the information that we discussed during the podcast, feel free to either reach out to Neuro Colorado or Connect My Brain, and we'll make sure that you get that information. Thanks for tuning in today. Sean, thank you so much for being on the show. And
thank you, Dr. Laura. It was amazing.
And everybody be blessed.